Sanitation, Hygiene and Water in Nigeria SHAWN II is a project funded by UNICEF and FCDO aimed at improving access to sanitation, hygiene and water supply to all citizens through eradication of open defecation, hand-washing promotion, sanitation and provision of water facility. Kaduna State being one of the beneficiaries of such project, coupled with the declaration of state of emergency in wash sector by Governor Nasser Ahmed El-Rufai, has recorded tremendous success in providing potable water, sanitation, as well as hygiene in various rural communities in the state.
Kaduna State government has made strides in eradicating open defecation. In this quest, we've had the support of UNICEF, which has funded the expansion of access to safe and potable water in many of our rural communities through the SHAWN II program. We are determined to build on these successes to accelerate the attainment in Kaduna State of the national goal to make Nigeria open defecation free, or ODF.
This meeting between officials of Kaduna State government and other stakeholders is to review the successes recorded under wash sector and plan ahead as SHAWN II project will exit by December 2020. Director General Kaduna State Rural Water Supply and Sanitation Agency, Engineer Ahmad Munir says Kaduna State government has achieved a lot in the sector.
This is a period for us to see what we have done in the past, where we are now, and where we're going to head to in the future. So there are certain indices. These are the ones for 2019. The ones that we are going to present to you, there will be another national survey early next year, which we'll present to you, and you'll certainly see improvements. And we are at the precipice. They are going to exit this December, and based on the realities of the world we find ourselves today, we have to understand that WASH does not end in Kaduna State with or without the development partners. So this is going to be a weaning period and a period for us to know that it is time for us to stand up and ensure we continue with the necessary investments not only to face the threats that we are facing today of COVID-19, but the inevitable future threats of viruses and other communicable diseases of the future. So we will be better prepared, we will be better organized, and basically we are coming out with innovations, whether it's through technology, through policy. So these are all the things that we are discussing with them over the next coming days.
Development partners at the meeting commended Kaduna State government's efforts in the area of water supply, sanitation and hygiene, but emphasized the need for more communities' engagements.
We had a very good success in some states, including Kaduna, in terms of expanding the range of communities that were declared and certified open defecation free. The key questions in a number of countries has always been what type of sustainable model can there exist once projects like this or initiatives like the PWASH maybe end or transition to something different. And I think what we're trying really to encourage now state authorities in particular is to really try to find creative models for community engagement, local government engagement, to make sure that these types of efforts that mostly come at very limited cost for the government and some quite significant cost for the actual beneficiaries, can be sustained through better access to improved materials, traditional business owners that can actually provide some of the basic sanitation services to those who are willing to actually invest in improving their sanitation facilities in their houses.
We have right now been able, together with RWASA, to put some processes that work. In terms of sustainability, we have been able to put the VLOG system, the village level operation and maintenance system, making sure that every single water facility, when there's a breakdown, in the next 2 days or 3, it gets repaired. Because there's a system with people, trained people, that can attend to that. So in very remote areas, we are able to secure this. So these systems are there. In terms of procurement, this year, with the COVID, we developed a e-procurement platform so that people will not gather, but still we can do and deliver. And Kaduna delivered more than 1,000 facilities from April to now. These are things that work.
Commissioner for Local Government, Jafar Rusani, and that of Health, Dr. Amina Baloni, appreciated RUWASA for executing laudable projects in WASH sector and urged it to sustain the tempo.
This is where I will really want to thank you, Your Excellency, for the leadership. Since my ministry was brought directly under your supervision, Your Excellency, you have demonstrated with very steady administrative hands, the way how we can do things better. So when the DG Rwasa was alluding to the fact that the Ministry of Local Government Affairs is really tremendously assisting him, I am sure he meant that the Deputy Governor and the staff are really assisting in that direction. But Your Excellency, we have no problem in transiting from SHAWN II to PWASH. We have a very young and dynamic management structure in that agency, and of course a work plan, a very robust one. I am confident that, as the UNICEF representative said, that all the milestones that have been so laid in that work plan will be achieved by the year 2023, and significantly that is even 2 years earlier than the national average.
We have had very good collaboration, I think, with RUWASA. We have followed the support that they've given, especially, of course, you said in schools, but even in the primary healthcare centers. We have had water facilities being placed in most of our PHCs, at least the focal PHCs. And in the move that the government has started with the revitalization, we've made sure that we've incorporated adequate water and sanitation provisions for the facilities, as well as toilets. Of course, during the pandemic, we've had very strong and robust collaboration with RUWASA. They're part of the Emergency Operations Committee. And they've provided hand washing facilities in most of the public places, markets, in offices, in schools, so that we can safely reopen and try to balance lives and livelihoods as we go forward.
Kaduna State Deputy Governor Dr. Hadiza Balarabe says government is doing its best to provide potable water and sanitation with a view to addressing waterborne related diseases in the state.
Part of what we're doing for human capital is to ensure that we have people who are healthy, and all ramifications of health. We're looking at all areas that have to do with health, including water and sanitation. We'll not relent on our oars. We have a vision for human capital, and we'll continue to pursue that. I want to say that as we close out by December, I want to extend sincere appreciations on behalf of the government and people of Kaduna State to the team for all that you have done, and for the much more that you'll continue to do going forward. I pray that God in His mercies will continue to give us wisdom as we take on all the responsibilities that are ahead of us. Even though Jaba is the first LGA to be declared open defecation free, But I think they're just opening up a floodgate for all the other local governments, because it's like, for me, it's like a competition. If I'm the first, okay, I've been the first, but what's the ginger for the other local governments? How do we get each and every one of them to key into this so that we can all be declared open defecation free?
I want to talk about the ODF in Java. Originally, we were supposed to coincide our ODF celebrations on tomorrow, on Thursday, I believe, on the 19th, on World Toilet Day. But I want you to know the importance that the acting governor takes ODF in Kaduna State. She insisted, not requested, that we shift the date to 24th because she'll be unavoidably absent and she wants to be there present herself for the first local government that we're going to declare ODF. So please, madam, we want to thank you. We want to thank you because this will send a shockwave to the other local governments to sit up. And it just goes to show that the amount of dedication that she has, and actually she has been an integral part of our success in Java. And I would also like to thank His Excellency, the Governor, for in his wisdom putting us under the wing of the Ministry for Local Government as our supervisory ministry, because that has really afforded us, in his wisdom or their wisdom as an administration, to really penetrate the grassroots and the local governments and our work departments that are under the local governments to really interact. And it has also been one of our secret of our successes.
This workshop, which had various stakeholders in attendance, is aimed at designing a roadmap for the sustainability of the project. Director General RUWASA, Engineer Ahmad Munir, shed more light on the workshop.
The aim of this function is for us to have a self-reflection and for us to reprioritize where we are heading to with the development of the exit of the SHAWN II project. And we need to evolve. We need to understand that this is not a transitional period. We should be a transformative society as a whole and ensure that we sustain the tempo to reach the 2025 ODF target, to reach the 2030 SDG goals.
Some key stakeholders also made their submissions during the workshop.
Implemented the project known as SHAWN in Kaduna State. It's a collaboration between UNICEF, DFID and Kaduna State government. And so far we have achieved a lot of results in this drive. If I can recall, when we started, the sanitation coverage for Kaduna State was 29%, but now that the project is running up, we're able to move from 29 to 55% as far as sanitation is concerned. For hygiene, we have also improved. It used to be 4.3, now we are at 25%. Though we have not reached 100%, but at least we have made tremendous progress. Along with this, some of the results that you will not see are the fact that now we have institutions, we have wash departments in local governments. RUWASA is also better able to handle massive procurements.
So the project is all about improving the sanitation access, the water supply access, and also access to effective hygiene in Kaduna. Well, the project is about ending. It's ending by December 2020, that's next month. And what we have come to do today is to look at what we have achieved, to reflect on how far we have gone on the project in terms of achieving the objectives set out for the project.
The private sector is an integral sector in as much as infrastructural development is concerned. And in this aspect, we are talking about total sanitation in our communities. And whether we like it or not, we can't do without the private sector. So it is really important for the private sector to come on board, to be involved in sanitation marketing, to start considering sanitation project as part of their corporate social responsibilities.
But that is not the end of WASH in Kaduna State, but rather it has laid a solid foundation for us to dwell on and to look forward to the future.
Provision of clean and safe drinking water as well as hygiene are central to healthcare delivery and other human development indices. As such, Kaduna State government says will continue to invest huge resources in that regard.